What if the scariest part of living with Lynch syndrome isn't the cancers doctors warn you about? What if it's the cancers they aren't fully sure about yet? Today, I want to talk about something that honestly sits in the back of my mind, having Lynch syndrome with an MSH2 mutation. Because when you live with Lynch syndrome, you realize certainty is rare. And sometimes the words increase risk but unknown are scarier than the actual numbers themselves. If you're new here, my name's Matt. I'm a colon cancer survivor and I have Lynch syndrome. Lynch syndrome is an inherited mutation that increases your risk of developing multiple different types of cancers in your lifetime. Now, with Lynch syndrome, there are certain cancers that doctors do talk to you about, but then there's another category that doesn't quite get discussed enough. And that's the one where researchers think there might be an increased risk, but the exact number and connections aren't fully known. And with this MSH2 mutation, I may have an increased risk for 2 cancers, and a third one I have some questions on. So the first 2 are going to be pancreatic cancer and then sebaceous skin growths. And the third one is female breast cancer. And I'll get to that a little bit later on kind of why I'm questioning it. But honestly, the difficult part with this is it's all unknown. And mentally, that's a weird place to be in on a day-to-day basis. Because when doctors say you may have an increased chance or an increased risk, but they also say, well, we don't fully know though, your brain kind of fills in the blanks, right? And you start wondering, well, should I be screened for this? How worried should I actually be? What symptoms should I take seriously? Am I overreacting? And that uncertainty can cause anxiety daily that just follows you around. I'm not saying it's panic every single day, but it's just being aware. And it's a constant awareness. All right, so the first one, pancreatic cancer. And so pancreatic cancer is exactly what it sounds like. Cancer of the pancreas. The scary part about pancreatic cancer is that it's often called a silent cancer. And a lot of people don't even notice symptoms until it's progressed. And some of the symptoms can appear to be just kind of regular day-to-day problems. I mean, especially as you get older, right? I mean, your back pain seems to be pretty common. Oh, I stepped down the stairs wrong. Or from the abdominal pain perspective, it's like, oh, maybe it's food poisoning or something. Maybe I ate something, or maybe it's the flu that's going around. It being an uncertainty scares me. I do get imaging on a yearly basis. I get an MRI and a CT scan. But since it's not listed as a known cancer I can get, is this something that I need to talk to my doctor about and say, hey, when I get that MRI, are we looking at that pancreas? And is it something I'm going to have to remind them about on a yearly basis until we learn more information about this pancreatic cancer and if it's actually something that can be part of this Lynch syndrome family? So the second cancer that I mentioned is sebaceous skin growths. And this isn't something I truly heard about until I started looking up information on Lynch syndrome. And now I have to remember, not every skin growth means cancer. Not every bump or spot means something serious. When you have Lynch syndrome, your brain doesn't always let you think clearly. A random skin change, most people would ignore. I immediately think, well, do I need to talk to my doctor about this? Is this connected to Lynch syndrome? Am I being paranoid? It's an odd space to live in because you truly have to question everything. So the third one that I mentioned at the beginning is female breast cancer. But the part that I question is it just female breast cancer? Now, there are cases of male breast cancer out there, be it a lot more rare than female breast cancer, but I have breast tissue. Am I at risk of this as well? Is there a variance to it? Is if it's female breast cancer, are you just a slightly higher risk or a nominal risk compared to what I have as a male for breast cancer? Is that something else I need to be getting checked or looked at on a yearly basis with my doctors? And there's no simple yes or no answer. I get it. Science is continuously evolving. Research is ongoing. But those things don't cover the emotional standpoint of it. And it can be hard because these are the questions that I live with every single day. I see a bruise, for example, and my first thought is this something serious? I don't know. It could have been I bumped my knee against the table, or it could mean something worse. And I just want clear answers. But I know with this and where we're at the current point with Lynch syndrome research, that's not possible. And so constantly thinking, is today the day that I discover that I have cancer again, is mentally exhausting. The other aspect of this with Lynch syndrome is, what if I develop a cancer that's not officially associated with this Lynch syndrome? What if I develop lung cancer or throat cancer, for example, right? Those are two, as of now, that I have not seen associated with Lynch syndrome. If I do get diagnosed with one of those, is it going to be connected back to Lynch syndrome, or is it going to be something that is on its own? And it's kind of a gray area, and it feels like science knows enough to warn you, but not enough to reassure you. And that's wild. The other aspect of it is that research is improving every single year. We're learning more and more about what Lynch syndrome is. There's been some studies out there, specifically according to aspirin, which I will touch on in another video. And people like myself who are trying to find a community, because the more we can talk about this and bring awareness to this Lynch syndrome, the better. If you're someone living with Lynch syndrome, or you know somebody who has Lynch syndrome, I would like to know your experience in the comments. And if this video helped you even a little bit, please feel free to subscribe. And there are more people that deal with this Lynch syndrome than most realize. This is not medical advice. Please consult a doctor if you have any questions. My name is Matt. I'm a colon cancer survivor. I have Lynch syndrome, and I hope to catch you on the next one.